What percentage of resting cardiac output is filtering through the kidneys at any given moment? A. 15 to 20%. B. 10 to 15%. C. 20 to 25%. D. 5 to 10%. The answer is C. 20 to 25%. The kidneys receive more blood flow than any single organ, after the liver. 20 to 25% of the cardiac output of the heart goes to the kidneys for filtration, the liver receives closer to 28%. This is especially significant considering that the kidneys account for approximately 0.5% of total body weight, while the liver makes up closer to 3% of total body weight. What is the main functional unit of the kidney? A. The glomerulus. B. The loop of Henle. C. The Bowman's capsule. D. The nephron. The answer is D. The nephron. The basic functional unit of the kidney is the nephron. The nephron is composed of the glomerulus, which is encased in the Bowman's capsule, the proximal convoluted tubule, the loop of Henle, and distal convoluted tubule. %of glucose and amino acids are resorbed in what part of the nephron? A. The glomerulus. B. The loop of Henle. C. The distal tubule. D. The proximal tubule. The answer is D. The proximal tubule. 99% of glucose and amino acids are resorbed by the proximal tubule of the nephron. The loop of Henle and the distal tubule primarily resorb electrolytes and water, while the glomerulus is strictly for filtration and does not resorb solutes. A nurse notes an elevated plasma creatinine in a patient with mild kidney impairment. How will this generally be reflected in the glomerular filtration rate, GFR? A. The GFR will rise, then decrease. B. The GFR will be elevated. C. The GFR will not change. D. The GFR will be decreased. The answer is D. The GFR will be decreased. The GFR represents the rate at which blood is filtered through the glomeruli of the kidneys. Creatinine is a waste product of muscle metabolism. Healthy glomeruli are capable of filtering creatinine very effectively, wherein creatinine is excreted in the urine. Generally, an elevated serum creatinine will be accompanied by a decreased glomerular filtration rate and is strongly predictive of kidney dysfunction. A nurse is performing the urine dip on a patient with edema. The dipstick shows 1+ protein. The patient is not sure if this is a normal finding or not. How should they be counseled? A. Protein in the urine is a healthy sign of proper excretion. B. Any urinary protein under 3+ is considered normal. C. No amount of protein in the urine is normal. D. Any urinary protein under 2+ is considered normal. The answer is C. No amount of protein in the urine is normal. No amount of protein in the urine is considered normal. The capillaries of the glomerulus are covered in a thin layer of cells called podocytes. These podocytes form a very tight filtration system that, when healthy, prevent all large molecules such as proteins from passing out of the glomerulus and into the Bowman's capsule, while allowing the passage of water, electrolytes, and smaller molecules such as glucose and amino acids. What effect does aldosterone have on sodium, water, and potassium in the kidney? A. Aldosterone decreases sodium and water resorption and increases potassium excretion in the kidney. B. Aldosterone increases sodium and water resorption and increases potassium excretion in the kidney. C. Aldosterone decreases sodium and water resorption and increases potassium excretion in the kidney. D. Aldosterone increases sodium and water resorption and decreases potassium excretion in the kidney. The answer is B. Aldosterone increases sodium and water resorption and increases potassium excretion in the kidney. Aldosterone is a mineralocorticoid hormone secreted by the adrenal cortex in response to aldosterone 2. An rise in plasma angiotensin levels will affect an elevation in blood volume, and hence blood pressure, by increasing the resorption of sodium and water in the kidney and increasing renal excretion of potassium. How much urine is produced by the average adult in 24 hours? A. 1,000 to 2,000 milliliters per day. B. 1,500 to 3,000 milliliters per day. C. 500 to 1,000 milliliters per day. D. 250 to 500 milliliters per day. The answer is A. 1,000 to 2,000 milliliters per day. Explanation: while normal function is possible with a urinary output as little as 500 milliliters per day, normal urinary output is between 1,000 to 2,000 milliliters per day, with 1,200 milliliters being average with adequate fluid intake. The absorption of nutrients and electrolytes from food occurs primarily in what digestive organ? A. The liver. B. The small intestine. C. The stomach. D. The large intestine. The answer is B. The small intestine. The majority of nutrients and electrolytes from food are absorbed in the small intestine. The remaining material passes into the large intestine for further transformation into stool. The liver and stomach are important sites of digestion and metabolism but are not the primary site of nutrient and electrolyte absorption. Which of the following is the main function of the large intestine? A. Resorption of water from stool. B. Passage of stool toward the rectum. C. Housing of intestinal flora colonies. D. All of these are correct. The answer is D. All of these are correct. The large intestine serves multiple functions. Large amounts of water are resorbed from stool via aquaporins in the large intestine mucosa, and the remaining matter is passed via a series of slow waves toward the rectum for excretion. In addition, the large intestine houses trillions of both beneficial and pathogenic intestinal bacteria and fungi. What is the name of the dilated portion of the rectum where stool is stored for elimination via the anus? A. The sigmoid colon. B. The rectal ampulla. C. The haustra coll. D. The anal canal. The answer is B. The rectal ampulla. Stool that has passed through the large intestine is stored in the rectal ampulla, a dilated portion of the rectum inferior to the sigmoid colon and superior to the anal canal. From there it can be passed into the anal canal and excreted via the anus. The haustra colli are segments or pouches formed along the length of the small intestine, demarcated by the smooth muscle of the tinea colli.